And we can begin letting all the guests in at this time as they continue to join. Thank you all for joining and welcome to the RBW PH Awareness Group's 6th annual RBW Mental Health Symposium. It is with excitement that we welcome KYB Amara to get us started. Welcome, Amara.
Hello, everyone. Welcome to the 2023 RBW Mental Health Symposium. I'm KYB leader Amara King, and a member of the 29th cohort of Dr. Catherine Y. Brown Leadership Academy. Founded in 2012, we remain committed to increasing the awareness of pulmonary hypertension while also building healthier communities. On behalf of my mentor, Dr. Catherine Y. Brown, and also our RBW Executive Director, Sydney Y.K. Brown, I am excited to bring you greetings on behalf of the Roberta Baines Wheeler Pulmonary Hypertension Awareness Group. Today, you are in for a treat. You will hear from amazing speakers on our theme, Awareness, Empowerment, and Hope. RBW PH Awareness Group mantra states, Awareness, Empowerment, Hope. Together, we can make a difference. At this time, we're going to put a brief survey in the chat. Please take 2 minutes to complete this form.
Thank you so much, Amara. And also remember, at the end of the event, we will ask you to complete a post survey so that we can see what you learned today. This will help us to see the impact of this program.
I would like to welcome KYB Leadership Academy founder. Oh, sorry.
Thank you so much, Amara, for welcoming me. I'm excited to see today's program, the 6th annual RBW Mental Health Symposium. The scholars of KYB Leadership Academy complete 7 competencies, in essence, 7 service projects, and this is one of our signature programs. There are many things that these scholars could be doing today, and we are thrilled that they have chosen to hone their leadership skills through the KYB Leadership Academy. Today's program will be educational, empowerment, and you are in for a wonderful interactive time with us. Thank you again, Amara.
Thank you, Dr. Brown. At this time, I would like to introduce my co-chair for this event, Ariana. Welcome, Ariana.
Hello, everyone. I am KYB leader Ariana Lee, a member of cohort 29, and I am excited you decided to join us today to learn about KYB Leadership Academy and the importance of maintaining positive mental health. KYB Leadership Academy is sponsored by the Roberta Baines Wheeler Pulmonary Hypertension Awareness Group, a 501c3 nonprofit organization which was founded on November 8th, 2012. RBW PH Awareness Group is named after Roberta Baines Wheeler, a nurse of over 40 years who was diagnosed with pulmonary hypertension and later advocated for pH awareness. The mission of KYB leadership is to build the capacity for global leadership while also increasing awareness of pulmonary hypertension. Today, there are over 250 KYB leaders nationally and internationally. Locations include Tennessee, Michigan, Illinois, California, Georgia, Indiana, Virginia, Medellin, Colombia, Johannesburg, South Africa, Lagos, Nigeria, and Turks and Caicos Islands. KYB at Fisk University was the first collegiate cohort. KYB at Tennessee State University was the second campus-based collegiate chapter of KYB. Howard University was the third college campus to approve of a cohort of KYB. We are honored that our organization continues to grow each day. If you are interested in joining KYB Leadership Academy, please email kybleaders@gmail.com.
Greetings, I am KYB leader Olivia Dove. I am very excited to be here with you today. What I most enjoy about being a member of KYB Leadership Academy is the opportunity to do community service with the RBW PH Awareness Group. I enjoy helping this amazing nonprofit organization fulfill its mission. Through my volunteerism, I will be able to serve hundreds of people in the community by providing education that they otherwise may not have had access to. I hope that after today, you will also be inspired to join KYB Leadership Academy and also volunteer with the RBW PH Awareness Group. The RBW PH Awareness Group held its first RBW Mental Health Symposium on the campus of Fisk University, September 9th of 2018. It has been held each year since that time, September 9th, 2019, virtually September 13th of 2020, virtually September 19th of 2021, and September 11th of 2022. Today is another historic moment for us. Today is an important day, not just because it is our 6th year hosting this event, but it allows us to discuss a topic that is much needed in the community, nationally, and internationally. We strategically placed this signature program during National Suicide Prevention Month as a reminder of the importance of discussing mental health. I want you to remember 3 words in one sentence today, so please repeat after me. Awareness, empowerment, hope. Together, we can make a difference.
We began the RBW PH Awareness Group Mental Health Symposium as a way to build awareness, empowerment, and hope because we know that together we can make a difference. Mental health is something that we often do not talk about, but if we consider health, mental health is a part of that. RBW PH Awareness Group's mission is to build the capacity for global leadership while also building healthier communities. With that being said, we are honored that you are part of our community commitment by being here today. At this time, we would love for you to take pictures. Please pull out your phones and take a selfie and post it on your social media using the following hashtags. Hashtag RBWPH Group and hashtag KYB Leadership. Once you post photos and tag us on social media, you will enter into a giveaway for an Amazon gift card. So please take the time to post now and throughout the event.
Hello, everyone, and welcome again to the RBW Mental Health Symposium. I would like to thank our event sponsors and community partners for making today possible. KYB Leadership Academy challenges us to design, implement, and evaluate 7 competencies, which are service projects. This takes hard work, discipline, and community partners, sponsors, family, friends, and leaders like you who believe in what we are doing. We are so thankful to you. Thank you again. I am excited that I have the honor of introducing our first speaker. Remember, our time together is about supporting each other, being transparent, and learning about resources, and recognizing the importance of good mental health. If you hear something profound, and we know you will, be sure to post the quotes on social media using our hashtag RBWPH Group, hashtag KYB Leadership. This helps us meet our goal today for RBW PH Awareness Group of those 3 powerful words: awareness, empowerment, and hope. Remember, together we can make a difference. At this time, I am excited to lead the introduction of our first distinguished speaker. Our first speaker is Dr. Lucretia Dangerfield. She is a professional counselor and will share about her background and today's topic.
Good afternoon. Thank you for the warm welcome. Let me get my screen up. But what I would like to start out is like, this is such a awesome topic to be talking about, the connection between mental health, physical health, because that is so important. You cannot have mental health without physical health, and most definitely your spiritual health. And so I want to start out by sharing a story with you. Think about a young baby being born 6 weeks early and had to stay in the hospital because she was premature. Her mom went home, her dad went home every night, but she had to stay, and they would come back the next day. And then once she gets home, she's the only child, so she gets to experience the love and the doting on by her parents. And then a year and a half later, her baby brother is born. He's born, and then 6 months after that, he passed away from SIDS. She really loved her brother, so she didn't understand because she was 3 years old. And what happened? What happens when people leave? So that created some anxiety. It's always about what will happen when people leave. That's part of my story. So I remember when I was growing up, I was always anxious. And I didn't know where that anxiety came from until I was older and came into the field to learn things about mental health. And so that is one of the reasons why I do the work that I do. I'm a licensed professional counselor here in Nashville, Tennessee, and I'm also a counselor educator where I help other mental health practitioners to become who they are as part of the work that we do to help to bring awareness and empowerment around mental health. So when you start the conversation about mental health, I want to define mental health for us because sometimes it gets mixed up in the words. People use mental health is interchangeably with mental illness, but there's a distinct difference. We all have mental health. That is something that we all have. So there's a continuum. Somewhere in the middle is mental health. That's what we all have. We all experience some form of mental health because mental health is our psychological and emotional well-being, our cognitions, the way we think, the way we process information, the way that we make decisions, the way that we feel, our emotions, our feelings. That's part of who we are on an everyday stance. So we all have mental health, but on the other end of the spectrum, or the continuum, as I like to say, is mental illness. That is when our behaviors, our feelings, our thoughts become distressful, and it creates distress in life. And those things are diagnosed by a psychiatrist or another mental health professional. And what happens is you may have to take medication, and you may have to have therapy on a more repeated basis, but there are things that we can do. But mental illness is on one end of the spectrum. We have mental health somewhere in the middle, like I said, that we all have, and mental wellness. That is the way that we promote well-being, whether it's physically, spiritually, and mentally. So I want you to keep that idea in mind as you think about a continuum, but knowing that we all have mental health. So as you think about that, there's some prevalences around it. And if we all have been around at least since 2020, we all have experienced some stress because in March of 2020, our life as a collective body changed. Pandemic. Things started to happen where people were having to stay at home, more isolation, you couldn't go out. And some people see it was trauma. And so we all experienced this collective trauma, and it impacted our mental health in some way. But I want you to kind of think about, if you look at just how mental health and mental illness differs, 1 in 5 people experience some mental illness. And then there are these mental health disorders that are used in a book that I use to have to work with some of my clients. And with that, it's a book of over 200 mental illness diagnoses. And with that, I want to kind of talk about something that is prevalent among young ladies, women, that anxiety and depression. And it shows up a little different for each person, but we all have some anxiety. We do. We all are anxious about something. There's something that happens. It's like, oh, what is those thoughts? What are those thoughts that happen? And sometimes those thoughts may lead to some sadness, but that does not mean that you have a mental illness. That may just mean that your mental health is trying to figure out what is going on. So it may start with a little fear. We all experience fear in certain situations, because if we don't know how the outcome is going to be, it brings up a little fearful thought like, oh, how's this going to be? What's the unknown? What am I going to do? And then it may cause us to worry a little bit, which is our thoughts. And then it may create some stress. That stress you may feel in your body, you may have your thoughts, and then you also may question within your spirituality, some of those things. But then anxiety is something that's where we're anticipating the future of what is going to happen. But like I said, that's okay. Those are normal things that happen to us all. Something that scares us. It may be something like speaking in front of a group of people or trying something new, but it's okay. Like I said, it's part of our mental health. It's the way that our bodies and our minds keep us in order. But then, like I said, with anxiety, you may feel some edginess, you may have some difficulty thinking, you may feel a little bit of irritability, you may have a little trouble falling asleep. But those things are okay. They may happen, but I don't want you to think, oh, something may be wrong with me. It's just that these things are happening. But when they become a problem, it's when the frequency, how frequent do these symptoms happen? How intense are they? What's the duration? When did it start? So you want to kind of think about those things. But okay, like I said, we all experience some anxiety. And the way that it impacts our mental wellness, and like I said, on that end of that continuum that we're working to get to, because like I said, the continuum where mental health is here in the middle, mental wellness is on one side, and mental illness is on the other side. But the way that we look at mental wellness is the emotional impact that it has. It may lead to some emotional distress, like I said, ranging from restlessness and irritability, and then it impacts the way we think. It may be our racing thoughts, difficulty concentrating, and excessive worry about future events. It may have some impact on our body. I know when I get anxious, the way it shows up for me is I might sweat a little bit more than I normally do, or I pace back and forth, or I might have to be like rubbing my fingers together. But there are things that I've learned to do to help alleviate some of that stress. And then a spiritual impact. It may have a strain on our relationships, have us questioning the way that we see our purpose and our future. And it can also lead to some self-doubt. But we can do some things to make that change. And I'll talk a little bit about them in a little bit. But then, like I said, anxiety, and then there's some depression, sadness, hopelessness, and it could be some different things. You may have some insomnia where you can't sleep, but those things are common when something happens where you may experience a little sadness, but it's okay. You like, oh, I was just a little sad today, but that doesn't mean that you have major depression. It just means that you have some sadness today or some lack of motivation. But if it gets more intense and more distress, then there may be more to it. So what you want to do is think about, okay, how long has this been happening? Do I have these symptoms more days than none over a 2-week period? And if that's the case, then you're like, okay, maybe I need to talk to someone. Maybe I need to make an appointment to go see a therapist or talk to my doctor. And as the young lady said in the introduction, and one of the reasons why today is so important is today is National Suicide Prevention Awareness Day. So when those thoughts sometimes get a little, they last long, and and people experience hopelessness, then they may have some thoughts. But then what we can do is help them to have the support that they need by giving them a safe place to talk and normalizing conversations around mental health, letting people know that mental health is an everyday thing. It's not something that just happens to certain people. We all experience mental health because we were born with mental health. So some of the effects on our mental wellness that depression may bring is some feelings of emptiness, sadness, loss of enjoyment. Some of the cognitive is, like I said, difficulty thinking, physical, changing your appetite, sleep disturbance, some of those things that you may find yourself not being able to do. And then the spiritual impact can be feelings of guilt and shame, loss of meaning and purpose, and challenges to our faith. But like I said, we're not going to stay there. We're going to move forward, because I'm going to teach you a couple things that you can do to help have impact on your mental health so that you can move to mental wellness. So, as I said, there's an intersection between our mind, our body, and our spirit. And like I said, our mind is where we have our cognitive processes, how we make decisions, our emotions, our intellect, and it impacts how we see life. It influences how we see life and our emotional experiences. How do we process what happened to us? And like I said, as a child, when I was growing up, I was an anxious child at times, but because I was thinking that someone was going to leave me, and it would show up for me is those running thoughts of like, what am I supposed to do? But then I got those feelings in my body. Our body is that physical thing that everybody can see, and you feel these symptoms in your body, are not symptoms, these experiences in your body. And it's the aspect, the physical aspect of who we are, and it can impact our overall well-being. And that could be like sweating, that could be your breathing gets real rapid, like you're like, oh, why can't I just ground myself and breathe? What's going on? So something that we want to practice is when we find ourselves having these running thoughts and we see that our breathing is speeding up, and then we find maybe our hands are shaking or things like that. Deep breathing is very helpful. What we want to do is be able to take a moment and ground ourselves in the place that we are, to be able to connect to our five senses. So we're able to see, hey, what is it that I see in this space that I'm in? What is it that I hear? What is it that I smell? What is it that I taste? And what are some things that I can touch? Because some of the things that I easily do when I am feeling anxious is I rub my fingers together and bring myself back into the space so that I can know, hey, I'm here, I'm present. So you want to think about the impact that our mind has on our mental health. And that comes with the power of our thoughts. If we think positive thoughts, then it does something for our mind. Our positive thoughts lets us know that things are good. And that could be affirmations, speaking affirmations over yourself. When you think about who you are, and one affirmation that I always like to help people create is, find out the definition of your name. What's the meaning of your name? And add I am in front of those words. So if you say, if the meaning of your name is beautiful, you say, I am beautiful. Because every time you're introducing yourself to somebody and you say, my name is, and you give them your name, but you're actually saying, I am beautiful. So think about that. Think about the meaning of your name. And when people are calling your name, they are calling you. If your name means beautiful, they're calling you beautiful. So for example, my name means wealthy. So when I say, hello, I am Lucretia, I am saying, hello, I am wealthy. When people call my name Lucretia, they're saying, hey, wealthy, how are you doing? So they're speaking it over my life. So we have to think about this. How do we process information? How does that make us feel? How do we experience our emotions? And some things that we can do is, if you go to therapy, or you can practice these things, is cognitive behavior therapy. And that helps us change how we believe with our thoughts, our feelings, and our actions, mindfulness, and also stress management. And you just need to recognize these symptoms and be able to seek professional help. Having conversations around it. Do not be afraid to speak up and share. When you are sharing your story, you're helping someone else out. So being able to share with other people or just ask for help. So being able to tell other people about what's going on with you is a door opening for so many other people. So our bodies give us off signs. Like I said, when we're having those thoughts, check to see how your body is. Is it stressed? Also, how are we eating? How are you eating? Because sometimes our nutrition has a impact on our food. How many times have you vegged out on snacks and then you feel sluggish? Or you eat food and it's like, oh, that food hyped me up for the day. So thinking about how our nutrition impacts our food. And another thing that really helps us out is exercise. Exercise and mental health. Getting out every day, doing 30 minutes of some form of exercise, it shoots off some good hormones within our body. So we're able to really lift our mental health by doing exercise or getting out in nature, that connection. And so some things that we want to think about is when we're dealing with stress is prayer, meditation. Like I said, seek help from a qualified mental health professional. Stay in touch with your support system. It's so important. Be very connected to the signs of your body. How is your body dealing with this stress? And set boundaries. Boundary setting is so important, and be very intentional about putting activities within your life that will allow you to be able to experience life as you will from a mentally healthy space. And the last piece is about your spirit and mental health. Spirit and mental health helps you to be finding meaning and purpose. We all ask the question, why am I here? And it's so important for us to connect to the spirit part of who we are. We all have a spiritual aspect of self. So being able to do that and integrating some spirituality into your daily life. And then also when we connect our spirituality to our spiritual practices to the things that we do, it sometimes provides a source of strength, resilience, and support that can help us move on and move forward in life. So some things I have 5 things I want to just really share with you is about how to impact your mental health. And that's so important. Do your inner work. That means reflection, self-reflection, asking yourself questions about why am I here? Who am I? Who do I want to be? Physically, spiritually, mentally, relationally. Ask that question. Do your mental work with that. Then do some movement. Like I said, 30 minutes a day can do great things. You walk, you stretch, you dance, you take the stairs, but make sure that you're doing some form of movement every day. Pause. And pausing means just taking some deep breaths. And it grounds yourself to the experience in the place that you are. Pause in life. So you want to make sure as you impact your mental health, inner work, movement, pause, ask for help. So don't be afraid to ask for help. Be able to ask other people to support you in the things that you do. Then the next piece is have a community, your social network. Who is in your network? Like I always say, who's in your village? Who are the people that will push you to be the best self that you are? Look to your community. And then most definitely, since as a licensed professional therapist, therapy is something that I promote because it's good to have someone that don't know you, can't tell your business because they are bound by law. They cannot share what's going on. There's only 3 parts of confidentiality where they can't share. And that's if you were to say that you were going to harm yourself, you were doing harm to a small child or a vulnerable adult, or you were going to kill somebody. That's the only time they can share something. So, but the other times you can go in, it's a non-judgmental place. You can talk and you can share with them what is going on. And like I said, therapy is something that I believe everybody needs a therapist. Everybody needs one. If the first one you go to don't fit, find you another one, because there are people out there that are looking to do the work and stand and walk out this journey with you. So, like I said, impact your mental health by your doing inner work, which your therapist can help you do that. Movement, do some movement every day. Pause, take a breath, ask for help, find your community, connect with your community, and most definitely do therapy. And I want to thank everyone for these few moments to be able to share about why the intersection of mental health with your mind, body, and spirit is so important.
Thank you, Dr. Dangerfield. That was a wonderful presentation. To our guests, I would like to ask you all to please do the survey that we are now putting in the chat. It's very helpful for us both before and after the symposium.
At this time, I would like to welcome KYB leader Olivia Dove, who will introduce our next speaker. There will be 3 speakers followed by Q&A.
Thank you, Amara. I am excited to introduce my very own mother, Dr. Kendra Dove, who will speak on coping with mental health in college. Say no to drugs and alcohol. Say yes to your health. Welcome, Dr. Dove.
Greetings, everyone. I'm sorry I had to get myself off of mute. I hope that everyone is doing well. I am currently in Louisville, Kentucky, where the sun is shining bright, and certainly that helps my mental health tremendously. I hope that the weather in Nashville is just as pretty as it is today. Thank you to the previous speaker for that amazing delivery. I think you all will find that there will be some overlap, but that is a good thing, okay? Because we want to, again, keep mental health top of mind all year round, be it the month of May or the month of September. So without any further ado, I'll go ahead and get started. Yes, mental health matters. I matter, you matter, and we matter, okay? All righty, so let's look at our agenda. We're gonna talk about awareness. So the awareness of suicide and suicide prevention and why our mental health matters. Let's talk about empowerment. And I feel as though knowledge is empowering. So let's talk a little bit about some of the illnesses of mental health. We'll look at the numbers, and I think you all would be so amazed at the numbers and how mental health affects our community. And then we're going to talk about treatment strategies. And honestly, I'm a pharmacist, and so that piece of it is indeed my baby. And so we'll certainly go into a little bit more depth about that. And then let's just talk about hope. Where do we go from here, and how do we utilize our resources? And yes, together we can make a difference. Okay, so I am not going to read all of this to you. I just want you all to take a little time to take a look. Again, this is day 1 of National Suicide Prevention Week, and this is a time to help raise awareness and discuss this often stigmatized topic. Suicide is the second leading cause of death among children ages 10 to 13, and the third leading among those 15 to 24. And the LGBTQ plus community, their youth are 4 times more likely to attempt suicide than straight youth. Let's talk about more pieces and information about suicide. There's no single cause. And unfortunately, it occurs when we have stressors in our life and health issues that meet and then create an experience of utter hopelessness and despair for those individuals. Again, depression is the most common condition associated with suicide, oftentimes when it's undiagnosed and untreated. And conditions like depression, anxiety, substance abuse, again, when they are unaddressed, they increase that risk. So what are some of the warning signs? How are people that are considering thinking about suicide, how are they feeling? They feel empty. They feel hopeless. What are they talking about? They're talking about wanting to die, being a burden to others. And then what about some of those behaviors that may change? They might be eating or sleeping more or less than they used to, or just showing withdrawal from the things they love, their friends and their family. So there are, again, ways to prevent suicide. Strengthening our economic support is big. We need to promote healthy connections. We need to teach better coping and problem-solving skills. Improve access, that is a big piece. Access to mental health care, and then lessen those harms and prevent future risk. So let's talk about mental health. Mental health is essential to our life in the same way as our physical health. So I want you all to think about it this way. With a type 1 diabetic that is insulin dependent, go without their insulin? No. Would an epileptic that requires seizure medication go without that seizure medication? No. So we want to, again, continue to focus on our mental health. And if indeed we have a mental illness, we want to treat that mental illness so as to, again, further and positively impact our mental health. So again, mental health includes our emotional, psychological, and our social well-being. And it's important at every stage of our life, starting from being a baby, as our previous speaker said, being a baby and moving into childhood, and then of course, moving into adulthood. So I told you all, as promised, let's look at the numbers. So mental illnesses are among the most common health conditions in the US. So 1 in 5, and this screen might be, or slide might be a bit redundant. Again, 1 in 5 US adults experience mental illnesses each year. And again, 50% of all lifetime mental illness begins by age 14 and 75% by age 24. What's the prevalence among our demographic groups? There are non-Hispanic American Indian or Alaska Native, 26.6%. How about Black or African American, non-Hispanic, 21.4%. And our non-Hispanic Asians, 16.4%. So those are staggering numbers for some. And as I mentioned before, the LGBTQ plus community, 50.2%. So as it relates to our young adults, and those would be, I'm speaking to the majority of this audience, 1 in 6 adolescents from the age of 12 to 17 will experience a major depressive episode. And these are 2020 numbers that were pulled from NAMI. So again, and this was right in the midst of COVID-19, and COVID-19 really shined a spotlight on mental health, the importance of mental health, and on mental illness as well. So, all righty. What about some of the warning signs of and symptoms of mental health? Low energy, difficulty concentrating, the inability to perform daily tasks, unexplained aches and pains, headaches, stomach aches. So those patients that suffer from anxiety, I know that my anxiety manifests itself in my stomach. So my stomach just, it doesn't quite feel right when I'm anxious about things. So can you imagine feeling like that all the time? And then the difficulty controlling feelings of worry is also a warning sign and symptom. What are some of the mental health conditions? As mentioned previously, there are over 200 types of mental illnesses. And those disorders vary from mild to severe. And what are some of the contributing factors? There are biological factors, so that's their brain chemistry, if you will, life experiences, a significant trauma, and then family history is associated as well with mental health conditions. So we're talking anxiety disorders. ADHD actually falls under that umbrella. Depression, schizophrenia, and OCD, or obsessive compulsive disorder. So let's talk about treatment. We just talked about psychotherapy and or talk therapy and how important that is. And those therapists help to provide guidance and support to individuals. And they just help those patients to normalize their thoughts. They help the patients to build their relationship skills, just to develop better coping strategies, and to feel stronger in the midst of the everyday challenges of life. And then there's pharmacotherapy. So prescription drugs are indeed the cornerstone of therapy for patients that are suffering from mental illness. So medications can affect us all in different ways. So sometimes it might take a little while for a medication to do what it is designed to do in our bodies. So it takes a little time to find that ideal regimen, to find the most effective dose, and indeed the most effective dose without side effects, or with the fewer side effects. Oftentimes your pharmacists are more accessible than your physicians may be. I'm just a phone call away. That's not to say I'm not busy, because I am, but I am indeed just a phone call away. And as a pharmacist, we can help to play an essential role in supporting mental health and being advocates for our community. So whenever you start a new medication, you always want to talk to your pharmacist about that. So what are some of the medications that I'm talking about? So antidepressants. Dr. Brown, if you'll just keep, yes, ma'am, just keep, thank you. Thank you. So antidepressants are used to treat depression. And these are medications that I'm sure that many of you all have heard about. They are called SSRIs or SNRIs. They can also be used to treat anxiety, insomnia, and pain. So Zoloft would fall in that category. Prozac, I know you all have heard that name before. There's also one that's not on there, and that's Lexapro. And then anxiolytics are used to treat anxiety. Okay, so we talked about before how prevalent anxiety and depression might be or the possibility of both might be in our audience now. So anxiolytics are used to reduce the symptoms of anxiety, panic attacks, and extreme worry and fear. So as I said before, medications that are classified as antidepressants are also used to treat anxiety. There are also some other ones out there, beta blockers like atenolol or propranolol. If any of you all are familiar with those or have friends or family that are on those help to fight that fight or flight reaction in our bodies. And that just kind of helps to suppress that worry and suppress that anxiety. And then benzodiazepines, which would be like a Valium, those are used for short-term use and in acute type situations, just to kind of help with that worry and ease your mind. Okay. And so then antipsychotics, you keep hitting that. There we go. Thank you, Dr. Brown. Antipsychotics are and I just included this because this would be one of the more severe mental illnesses that are out there, but they are used to treat psychosis and also to relieve symptoms of delirium or dementia. And I say dementia because some of you might have family members out there, grandparents, or friends that have grandparents that might suffer from dementia. And some of the newer antipsychotics are indicated for those patients. So just again, to just kind of heighten your awareness and make you aware of some of the medications that are out there on the market to help treat mental illnesses. And then finally, the stimulants. So those would be, will you hit the button one more time for me, Dr. Brown? Perfect. Thank you. So those stimulants help to increase alertness, attention, and energy in patients that have ADHD. Okay, and they're very effective in improving the daily functions of patients that might be on the medication. Ritalin, Vyvanse, Adderall, all of those are medications that you might be familiar with. And then finally, as far as pharmacotherapy is concerned, always talk to your healthcare provider about all the medications and vitamins and supplements that you're on. Be sure to understand how to start and manage your regimen. You might not always start out on that ideal dose or the final dose. Sometimes it takes our bodies a little bit of time to adjust. So you might start off on half a tablet, take that for a week, then bump up to 1 tablet and take that thereafter. But always be aware of how your medication is to be taken. And if you experience any side effects, let your doctor know or let your pharmacist know. Never take anyone else's medications, you all. That is not a good idea. You might have an allergic reaction to it. Or again, as I stated before, our bodies are all different and medications react differently in all of our bodies. So just keep that in mind. And then always, as I mentioned before, allergies are a reality. If you do have an allergy to a medication, that can be problematic. So make sure that your doctor and your pharmacy are aware of all your drug allergies. We talked a little bit about this previously, the importance of self-care. So when it comes to treating mental illnesses or when it comes to supporting our mental health, it's kind of a 3-pronged process. So we talked about psychotherapy, we talked about pharmacotherapy, and then we talked about the importance of self-care, taking time for you, okay? Diet, get enough sleep, get a pedicure. Essential oils are effective in some instances. Meditation and just kind of centering yourself, relaxing, those deep breaths, all of that helps in the long run. So, hope. I hope that you all will now look at, just think about, again, our previous discussion, and then this current discussion. Hopefully now you all will look at mental health through a different lens, a lens of understanding, a lens of optimism, because now you're armed with that information that you need to react or to help or to support, and then also courage. We have to recognize, I hope that you recognize the vital importance of a healthy mental outlook, which supports your physical and your spiritual health. So again, spiritual health, and then you realize your worth and know that you all are more than enough. So let's keep the importance of mental health on the forefront, and that requires a commitment from your doctor, me, your community, your family, and your friends. So together we can make a difference. Yes, it takes a village. The month of May, the month of September, yes, that time provides a dedicated time for us to come together and discuss mental health and just kind of take a deeper dive into both. But we need to normalize our conversations about mental health so that we feel empowered to seek help and support if we need it, if it gets to that point. We got to end the stigma. We have to show compassion. The isolation and trauma of COVID-19 shined a spotlight on mental health. Social media, gun violence, cultural unrest have all compromised the mental health of our children and our young adults. So we have to be mindful of that. And again, as I stated, it takes a village. Your friends and your family. If you see something, say something. Lend a helping hand, or just listen sometimes. Community and faith leaders, oftentimes our faith leaders are first line. They're the ones we go to talk about what we have going on. They need to be armed with all the correct information and how to support and how to guide. Parents and caregivers, that goes without saying. And then our educators, our teachers are often the ones that say, I don't know, little Tommy or little Susie's having a little bit of trouble focusing, or maybe having some behavioral issues, or just maybe just isn't themselves. So let's talk about it. Let's see what's going on. Let's dig a little deeper. So together we can make a difference. And again, help is just a phone call or a text away. I included the suicide hotline there. There's information at the Substance Abuse and Mental Health Services. Findsupport.gov is a great resource. And then for our expecting new mothers, new and expecting mothers, postpartum depression is real. And in some instances debilitating. So for some moms, so that is indeed a resource as well. So are there any questions? And thank you.
Oh, Dr. Dove, in the chat, there is a question. Shania McKinley would like you to touch on the importance of mental health in our student athletes.
Oh, wow. That is definitely something that would warrant attention. There's a tremendous amount of pressure, if you will, that our athletes deal with. Also, just being able to juggle it all, being an athlete for a high school or in a college, as well as juggling that with your schoolwork and then juggling that with your personal life. So I think that the self-care piece comes into play. I think that, sometimes we just have to know when to say no, or we have to know how to ask for help when help is needed. So talk to your coach, talk to your teachers, talk to your family. If it becomes too much, there are definitely resources and options out there. Never, ever go at it alone, as they say. Make sure that you have a support system, and that support system is very important. And you want to keep the lines of communication open as well with all of those individuals. I hope that helps. Okay.
Thank you, Dr. Dove.
Thank you.
That was wonderful. I am excited to introduce Ms. Deborah Swope, who will speak on the reflection from the world of counseling, lessons learned, and how you can thrive in the post-pandemic world.
Well, hello, everybody. I have been very uplifted by the information that I've heard. It's like I'm a dinosaur, okay, in what I'm doing right now. I've been a MED LPC for over 40 years, and I've been retired for about 10 or more years, so I've been kind of out of the loop. Some of the things I have worked with disadvantaged youth and their families in different situations. And I really had to think back because my resume, I had to kind of cut it off in terms of some of the things that I have been exposed to doing. I've worked in nonprofits, with schools, with adolescent psychiatric clinics. I've been an administrator as well as direct service. And my main method when I was actively working of counseling was uh, always strength based, regardless of how can I say it, what treatment plan would come before me. I would always look at the individual, and talk with them first, in terms of them being a part of the treatment plan and getting to know them, then I would read the treatment plan, and we would go from there. I have done behavior modification, group therapy. I had to write everything down, individual therapy. My specialty was always sexual abuse or any form of abuse when I was working, okay, as well as neglect. So I've always been strength based in everything that I have done. Um, I've done peer counseling, mentoring, grandparent mentoring. Um, let's see, parent education. And my method has always been in working with individuals, trying to get them after we have a session to give them homework so that they'll be more prepared. I'm sorry. More prepared for the next session. And they seem to get more out of that. So that is a brief of the work that I have done in the past. Does anyone have any questions regarding that?
I have a question. I would like to know more, like maybe a specific story about like your experiences with like a client or something like that.
Okay. Well, there's so many. Oh, I can relate to when I first started, and most of you were not born. Okay. And I was working for Montgomery County Children's Services. And at that time, there was a family I was working with where the parent had severe alcohol problems. So alcohol wasn't my specialty at that time. And so I had worked with her in terms of trying to um, build up her system in her home and her system, with the county in terms of trying to get her children back. But so far in this situation, the children had to be removed. And there were 5 kids, and I never would forget that because I had felt that I had done all I could. But she has to do the work, and how I used to work, when I was working, I let the clients know that I'm not your savior. Okay, I can introduce you to different thought patterns in terms of working with the problems you have, but you have to do the work in terms of, your mental health healing. Another one was a sexual abuse case I had that was involved a man. Not many people know that men can be victimized as well. If I'm going off key, just let me know. Okay. And they can be victimized as well. And so forth. I'm just going to kind of give you a briefing because these are the ones that are standing out in my mind. He was working at the Y, nice young man. And so he came into the office because he felt that he was gay because of the reaction to the rape. And I had to get into the physiologies of the body and, a lot of self help he had to receive from counseling. And also, I did refer him to some other groups that could, walk him through what he had gone through. But he eventually, because I think we had a few sessions in terms of what with him, and he got to really know more about who he is, how it was affected by the trauma that happened in his life, and that he did not cause the trauma himself. He was just in a situation where he was raped in terms of other women that can accommodate and have that situation going. So those were the two that I can think of. I'm sure there are more that I could talk about. Um, I've learned over the years in terms of using peer counselors, and I'm gonna just talk about that for a second, if you don't mind. Peer counseling, when I was working with the Urban League, it was a peer counseling program. And what would happen is we would go into schools, talk with the counselors. The counselors would recommend young people um, that they felt would really be beneficial, in the role. And they would be trained in communication. They'd be trained in anger management, problem solving and resolution, and things of that nature. And by the time they had gone through that process, at that time, then they were um, scheduled in their schools to do the work. But they always had adult supervision. So don't think, because they had this little certificate that they were, uh, they deemed themselves, professionals. They were not professionals, and we knew that. But they could more or less relate to kids on different levels, than maybe an adult could. So I always thought that that was a good program. I haven't seen any of them recently, but so I don't know if they exist in this city or not. But that can be a very effective tool, and having kids to really have leadership roles, and you really learn how to help others at that time. Okay. Anyone have any other questions for me?
Thank you, Ms. Swope. I would like to introduce our next speaker, Ms. Jessica Smith.
Uh-huh.
Hello. Okay, there we go. Hello, hello. Thank you so much for having me today. This is such a great event, and I think the more awareness we can have on mental health, especially with our youth, the better. This generation is new to this. It's not new to them. They're learning about it. I think even my generation, my parents weren't big on therapy, and so just to be able to be here and to talk to you guys about it is really great today. So thank you for having me. I am Jessica Smith. I am the CEO of Smith Behavioral Health and Wellness. It is a group practice here in Nashville, Tennessee. We see clients hybrid. We have a hybrid office, so we see clients in office, and we also see clients virtually. When COVID happened, definitely threw us into more of a virtual practice, but we do offer in person. Today, I'm going to talk to you a little bit about why I chose to be a therapist, and some of the things that came along with that, how I got to be a therapist. I am from a small town, Paducah, Kentucky, about 2 hours northwest of Nashville. Grew up in a wonderful home, have mom, dad, sister. I think it was early on, I knew that I wanted to work in a helping profession. I grew up in a home where there was a lot of love. I also grew up in a home where my parents weren't super emotionally aware. They weren't aware of their own emotions, and they weren't necessarily aware of me and my sister's emotions. And with that came some things. I developed anxiety, much like Dr. Dangerfield mentioned, having anxiety as a child. And I grew up with that. We didn't know what it was at that time, but I grew up with that. And when it was when I got into college and started to learn more about anxiety, going to therapy and things like that, I was like, oh, this is what this is. Okay. And I was being helped by therapists, and I had that experience. And it was then that I decided this is what I want to do. I want to help people in this very particular way. But I was really big on helping Black people in that very particular way. I felt like if I had the opportunity to reach people, maybe they could have a different experience in our households, in our schools. And so I sought out to be a therapist. I got my undergraduate degree at Lipscomb here in town, and did the basic psychology classes initially, and then got into some more very specific classes. And I got my degree in psychology, graduated with my bachelor's degree, and then went on to get my master's degree at Lipscomb as well. And in my master's degree, of course, there was like a track, and there were very specific classes to help us with what it counseling theories. It was counseling techniques, helped us to learn more about diagnoses, which you've heard a little bit about today, depression, anxiety, and some of the others. And I got to be well versed in those things. And then I graduated. That was a 2-year program, and I graduated. Upon graduating, I started what we like to think of as our postmaster's work. Here in the state of Tennessee, we have to get 3,000 hours of indirect and direct contact with clients. And so 1,500 of those hours, I saw clients under the supervision of people who were already licensed. I worked with different people at my different places of work. I worked at my mobile crisis here in town. I was working with people who were suicidal, homicidal, psychotic. Some of the greatest work I've ever done, and also some of the hardest work I've ever done. But it was so gratifying to be able to work with people, help people when they needed it the most. I continued to work, and I continued to be supervised. And I also continued to get my indirect hours. That would be more of your paperwork, learning, going to different workshops, learning different techniques, continuing to build on what I had learned in school. And once I got all those hours, my supervisor signed off on those, and I started taking tests. There are 3 tests here in the state of Tennessee that we take to become a licensed professional counselor. I'm a licensed professional counselor with a mental health service provider designation. And that basically means I'm a licensed professional counselor. I see clients, and I'm also trained to diagnose certain, not all diagnoses, but certain diagnoses. There are some diagnoses that we might refer someone to a psychologist or psychiatrist to diagnose. There's more screening that has to take place in order for us to know exactly. And we're not trained as therapists, mental LPCs, we're not trained in that. And so that referral, we send that referral on. But I went on to take my tests, the NCE, the National Counselor Examination, the NCMHCE, which is the examination that allows us to be able to diagnose, and then the jurisprudence, which is our Tennessee law. Once I pass all those tests, I send that stuff into all the information into the board, and the board approves a license. And so that is what the process that we go through to become licensed. I am also, I'm also a CEO. I run a practice here. And so with that, the way I practice, I wanted to train other people to kind of practice that way. And I think earlier, earlier, I believe it was Dr. Dove and Dr. Dangerfield touched on this. We practice from a very holistic standpoint. I don't believe that we can talk about mental health and mental wellness without addressing the other parts of ourselves. That is the spiritual wellness, that's occupational wellness. And in terms of students, it might be your educational wellness, our financial wellness. Do we have what we need? My goodness, I mean, I know we talk about halt, hungry, angry, lonely, tired. We don't really function well if we're hungry. We don't really function well if we're tired, right? So if our basic needs are not being met, sometimes it's hard to do therapy. We have to get those basic needs met before we can put those other things in place. And so at my practice, we practice from a very holistic standpoint. That is also where we get to see warning signs. We get to see if a person is withdrawing socially. If a person is withdrawing socially, okay, well, why are we withdrawing socially? What's going on here? Is it our friend group? Are we having issues here? Are we being bullied? That's going to impact our mental health, right? We get to look at things like are things going well at school? Do we feel safe at school? Do we, do we feel like we can be okay at school? And that's been a big thing for us here recently, given that we've had some things happen even in our own city. And so, safety is a big piece of our mental health as well. If we don't feel safe, then a lot of times we're not going to be able to learn. And so we practice from a very holistic standpoint. We hit those other pieces and we help people to understand how everything is connected, because it is. Again, mental health is not an isolated thing. Mental wellness is not isolated. And so to be able to know what's going on with us, to be able to know what's going on in our bodies, to be able to know when we are withdrawing or when we, are overwhelmed, what we can do, to know when we don't feel safe. That's another big one. What does it look like to acknowledge that in our bodies and figure out how we can be safe? Those are some things that we get to attend to as well. I feel like those are the big things. Let's see. Warning signs in youth. I talked about a little bit of those, a few of those, but definitely withdrawal is one. Isolation. I know in the world, in this world that we live in of social media, that's a big thing. I struggle because I didn't grow up in the world of social media. I think I picked that up in college. But with students, with kiddos, with young people, it's school, it comes home with them a lot of times. And so being able to know when to shut things off, to be able to create some boundaries there as well. Mood swings are another one to look for. Dipping grades when the grades start to fall, or when we're not performing the way that we want to perform. Those are some things to think of too. And to know that you have support, to reach out to those people in your village, to be able to know who you can talk to, whether it's friends, family, school administrators, people, your friends' parents, people in your groups, your social groups. Those are the people that you get to reach out to when you need that support. So yeah. Does anyone have any questions at this time? Cool. If not, thank you so much for having me. It's been a pleasure.
Thank you, Ms. Smith.
Thank you. Please join me in a virtual round of applause for our three amazing speakers. At this time, we will welcome questions from the audience. Please unmute or use the chat box. So, yeah.
I will be asking the questions from our awareness category. I would like to ask all the speakers, what are impactful methods of self-motivation when you are feeling defeated?
I'll go. For me, I have amazing family. My parents are my parents and my sister, my brother-in-law, and my 4 nieces are my biggest supporters. So my family, I would say, would be who I would talk to when I feel defeated.
I would have to piggyback on that as well. I have an amazing support system in my family and friends. So I'm a talker. I like to talk it out. And my mother and my daughter are actually my biggest fans, if you will. So they are usually the voice of reason, and they keep me grounded. So talking about it and utilizing that support system is a big deal for me.
For me, I just go to the Lord and I pray about things. And I also like to walk. And so I'm a good walker in terms of getting exercise. So that's how I deal with situations when they get out of sorts.
For me, similar to what Jessica and the others have said, is family is my family support, and then I have a tribe of friends that when I'm feeling defeated, I just have to reach out, text, call, say, hey, need to talk. And they're there to say, hey, let's talk about it. And so having that tribe of people to support you, and then also as Ms. Swoop says, getting outside and walking in prayer is another piece that's so important to me.
Thank you. We have another question from Miss Eleanor Shelfield in the chat. She asked, is seeing patients virtually just as effective as seeing them in person?
My practice is virtual, like 100% virtual. And I haven't seen a dip. My clients, they're like, oh, this really works, especially those that are able to set that private time, because what they say is I don't have to go in traffic, be flustered trying to get across town to see my therapist, that I can do it on my lunch hour, and then I can do it after work. But they have I haven't seen a decrease, and they still haven't come up with like statistics and the research. They haven't came out with a lot saying whether there's a major difference.
For me, I like things more interpersonal. So I like the face-to-face type of contact. That way I can watch the body language and know more about the person. So that would be my preference instead of seeing someone virtual, if or after now.
I would say virtual has been amazing. I think that it has given people more access. I'm licensed in Tennessee and in Kentucky. And in Kentucky, it's a lot of rural. I see a lot of people who live in rural areas. And so I think that that virtual option has given everybody the opportunity to be able to see someone, to see a mental health professional. And I think that's amazing. And also the ability for convenience, if you can pop on, during a lunch break, or like you said, Dr. Dangerfield, not having to go through traffic, because how many times have I had to de-escalate? We've had to deep breathe when we get into the office because, people are so activated. And so, it's been I think it's been an amazing way for people to have access.
Thank you. Okay. How can we empower and be supportive of family members or friends experiencing mental health issues?
I'll start. One is when a person, if you being very aware of how a person is showing up, being very mindful, and then being able to ask the questions. A lot of times what happens is individuals are afraid to ask if they notice that a family member or a friend is not themselves. Like they notice that either they're being more isolating, or they're more irritable. And then just ask the question, say, hey, you want to talk to me and tell me what's going on? And then if they don't want to say, but I know some resources, if they don't want to talk to you, so I know some resources that I would like to share with you. But being able to be supportive and opening up the conversation around awareness, empowerment, because we know if a person is aware, then they can make some choices. And as we're having these conversations like today, making mental health no longer taboo, but a way of life and a way of living is part of our conversation.
I think I'll add to that too. I think making people comfortable, creating a safe space for people to be able to talk about it. Because I think it can definitely be hard for people. And then also learning about it, taking the initiative to get more information about it. You know, not everybody understands anxiety, especially, and I'll go as far as to say in the Black community, anxiety is like, what is that? What is that? You know, even depression to an extent. You know, we historically have had to work through a lot of things, and when we're not able to work through, well, what's wrong with you? You know, and so to be able to learn about what's going on, to be able to understand better, even with our kids, like, what does it look like in them? What are they experiencing? What are you feeling? You know, and to be able to learn about it on our own, but then like Dr. Dangerfield said, to ask the questions as well, to understand their experience of it.
Thank you. Okay, Dr. Dove, I have a question for you. What are some things that make you happy when you're having a tough day?
Well, this might sound corny, and I'm not just saying this, but talking to you, hearing my children's voices just makes my day. My dog, we are new dog owners, and I used to wonder, golly, at the pharmacy, people come through with these dogs in their cars, and all my texts are like Google and Gaga on over, and I'm like, what is the big deal? Well, now I know. So that brings me joy and happiness. Dr. Dangerfield mentioned just jumping on a chat with your village or your tribe, my girlfriends. They will pet me up in a heartbeat. So, you know, just simple things. And the older you get, you all will realize that it's the simple things in life that mean the most. But you got to get there. But those are the tangible things that make me happy, if you will. Thank you for the question.
Yes, of course. Thank you. And all of our other speakers, you are free to answer that question as well if you would like to.
For me, it's music. You know, I love listening to music. It's like relaxation. You know, I like all forms of music, classical, jazz, whatever you have. You know, if I'm in a need of it, I use the music. And that's what I do.
For me, it's if it's a tough day, I'm gonna find something funny on television and watch it so that I could get a good laugh, even if it's something I've watched before. But just being able to get a good deep laugh at the end of the day to say, hey, it's gonna be okay tomorrow.
For me, it is FaceTiming with my nieces. I have triplet nieces. My sister has 4 children. I have 0. But my sister has triplets, 3 2-year-olds and a soon-to-be 6-year-old. And I call and FaceTime with my brother-in-law, sister, and my nieces, and it's very uplifting. And it makes me very thankful that I live alone.
Thank you. Okay, now we are going to transition to our next set of questions from Ariana.
Thank you, Olivia. I will be asking questions from today's empowerment section from our empowerment category. And this is for all speakers to answer. What advice would you give to students and people experiencing burnout and feelings of discouragement?
I'll jump out. It's funny. I was like, we waiting to see who's gonna say who's gonna say something. But for students, one gaining clarity about what's going on, because we know that our students are impacted by all the coursework, like if it's not being your education, if you're involved in social activities, being able to prioritize what's important, and then being able to ask for help. Being able, when you're feeling it, you're like, I need some help. You don't have to feel like you have to shoulder it all along. And then also checking with your body to see where you're where you're feeling certain things within your body, so that you can say that this is feeling a little uneasy or a little heavy, and having the conversation with family, friends, teachers, people in your community.
Mm.
My next question is, what are some ways to help manage mental health concerns?
Can you repeat that question one more time?
Yes. What are ways to help manage mental health concerns?
I would say having positive self-affirmation, would help in that area, and just learning to sometimes breathe, and just take a moment to reflect on self.
And my final question from the empowerment category will be, what do I do if I'm worried about my mental health?
So just as we've been discussing today with all of the panelists, is to seek help. Make someone aware of your concerns. Make your parent aware. Make a friend aware. If you don't feel comfortable talking to your parent, talk to your counselor at school, or talk to maybe some of your one of your friends' mother. Olivia's got a great group of friends and moms who I know she feels comfortable talking to, and I believe they feel comfortable talking to me as well. And so you never know, that could be a good resource. But just making someone aware of what you got going on, and definitely not internalizing it, and not saying to yourself, okay, I can do this myself, because you can't, and asking for help, there's nothing wrong with it.
I think there is that common misconception too, that we can handle it all, but and you might, try, but you don't have to. You can choose to talk to people. You can choose to, I use the analogy with my clients a lot of times. It's like you're walking with bricks in your backpack, like so many bricks in your backpack, but who can you give one brick to? That's not so heavy. How can you drop off some bricks? Like, how can you like lighten that load? And that involves community. It involves community and using your community to help you. Yeah.
Thank you all so much. I will now pass it over to Amara.
Thank you, Ariana. I will be asking questions from our Hope category. So, Dr. Dove, what resources are available to students or people who are experiencing a mental health crisis?
So I included some of those in my presentation. There are actually resources. We've got resources at our pharmacy. There are resources at your doctor's offices. There are resources in your schools. So I would say for students, reaching out to, again, your school counselor, teachers, coaches, they are all armed these days with information and again resources to help students that might be in the midst of a crisis or on the verge of. They can help you to find your way, if you will, and lead you to the right people. And then again, as we mentioned too, your faith leaders, your church, that could also be a good resource for you.
Mm-hmm. Another resource that I can think of are the libraries. The libraries have a lot of information, in their teen center that could possibly be a resource.
And something that Dr. Dove had put in her presentation that has been new, that's been out in the last couple years, is texting or calling 988. They have professionals available to talk to you. It's a crisis line, but they are there to talk to you and support you. So I know a lot of students, they have their phones connected to them. They can text 988 and reach out, and there's someone on the other end that will respond to them. And then if they need to get on the phone, have a conversation.
Okay, what do we do if the resources we have used in the past don't help?
Continue to reach out. Continue to reach. Yeah, don't stop reaching out. Because usually there's like that one person that you can connect with. If they don't know, most people, especially like teachers, other professionals, if they don't know the answer, their response usually is, I don't know right now, but I can get back to you and I'll help you connect to a resource. So being able not to don't give up, because that first avenue may look like a closed door. Connect with somebody else. There's so many different things, so many resources available. And but another thing is like finding like 2 or 3 things that work for you.
Okay, what are practical ways to stay aware of the state of our own mental health and to not get lost in constantly working and always being busy?
I struggle with this as an adult, so but slowing down, taking time to consciously, intentionally slow down. And that might look like changes even in how you do other things. Like maybe I go to sleep a little bit earlier so that I wake up with enough time to mindfully get dressed, eat my breakfast, get my things together and, go. That's one. And then 2, I am a big advocate of journaling. I don't care if it's bullet journaling, just brain dumping, writing whatever comes to your mind. Being able to be still and undistracted to get those things out, just whatever is coming up for you. Because I guarantee you, if you're quickly moving through your day and we're on autopilot, we're not paying attention to those things, and those stressors and even those micro stressors, they start to build. And before you know it, we're like, why do I feel like this? Why do I feel so overwhelmed? It's because we haven't been attending to those things. We've just been moving through. And so trying to find ways to be still and also to move slower, and then make dedicated time to just sit with self and reflect and process.
If I may say something to Ms. Smith mentioned that Well, first of all, Dr. Dangerfield said in her slide, just pause. Pause and again, be still. But when I was your age, I don't remember having discussions about mental health and mental health awareness. I just don't. So, and as an adult, as Ms. Smith said, I don't do a good job of what we're even talking about, the whole self-care piece. I try, but so take heed to what all of these panelists have said now and start practicing that whole self-care piece and that holistic approach piece. And then when you do become an adult and a mom and later in life, you'll be used to it. You would have already developed a cadence. It'll already be a habit for you. So just keep that in mind. I think if you start early and get used to these things and doing these things and taking time for yourself and intentionally, you'll do a better job of it in the long run as an adult. And we all know stress leads to other things. So we want to try to keep that at a minimum, and that'll help with the mental health piece. That'll help with the physical health piece and the spiritual health piece. So
I will also add to that. One of the things that I like to remember is that prevention is better than treatment. If we can prevent something, then it's going to be, and if we have to treat it, then we have to treat it. That's neither here nor there. We're going to treat it, right? But if there's something we can do to prevent it, and if that something is finding ways to slow down, be still, take care of ourselves, take good care of ourselves, then that's probably going to lead to an outcome of something that we don't have to treat. We can just live and be happy and enjoy. And so just remembering that if I can do something to prevent something, then that's going to be better than treating it, essentially.
I have a question from the chat. For those actively practicing, are you taking new clients? What is the best way to connect?
We are at Smith BHW. I'll put it in the chat too. You can just send an email or send an inquiry through the website. It's smithbhw.com.
I currently have a couple slots available. If I'm not a good match, I always work to connect you because I work with other mental health professionals that I know who have availability and affordability. So if you want to reach out to me, I can help connect you to other people.
Okay, before we end our question and answer time, I have one final question for each speaker. What is something you've experienced regarding your own mental health and how did you overcome it?
Well, I had the passing of my mother and some different family members, and it was very rough for me. So what I had to do was really go into myself and to remember the positive things about the person versus the passing and always keep them in my heart. But it's been rough. So that was really something recent for me.
I'll share. For me, I think it was at the height of the pandemic. What I found myself, especially when days get shorter and the sunlight is not out there, realizing that I at times deal with season affective disorder, where because the days are short and it's wintertime, it's like so what I had to do is, one, I got a therapist, but then I became very mindful that starting in September, October, when those days start getting shorter, to make sure that I optimize my daylight by going outside and getting some sunlight. And also there's some lamps with some proper lighting that you can buy, or light bulbs, and putting them in my house to make sure that I'm getting the right amount of SUV rays. But most definitely my therapist, having conversations with her around what's going on.
So I guess it's a tough one for me. Right now, I am in a space in my life where I have my daughter who's going off to college. I've got a 10-year-old. And then I've got, on the other side of the spectrum, I have parents that are aging. And we're actually in the process of moving them to Nashville. And then I have a very busy schedule at work. So in this discussion, this symposium has been wonderful for me, because I'm going to start implementing, I need to start implementing some of the things that we've talked about, so that I can better cope with everything that I have on my plate. So while I've not necessarily experienced that in the past that I can think of, I can't really think of what I've done in the past. I can tell you now what I'm going to do. And that's exercising, getting back on my Peloton, and getting back to listening to my music like I enjoy doing. And again, just staying close to and keeping that support system alive and well.
This is interestingly timely. Am currently kind of going through that. You know how we talked about the holistic piece, and like, you know, that physical wellness and that mental wellness being connected. And I'm a big advocate of going to the doctor and getting my yearly physicals. And what we've been seeing is that my blood pressure has been pretty high. And what we have pretty much deducted is that it's just stress. And so put my thumb up there, finding ways to take better care of myself that include like watching what I eat, the way that I eat. Am I eating enough? Am I eating enough of the right things? You know, taking care of myself when it comes to movement, making sure that I am moving. And then also taking care of myself just mentally, making sure again that I'm slowing down, that I'm actually like, you know, taking time to do things and giving myself enough time to do things. So that's one way that I've had to work through that mental, emotional piece, as well as the physical piece.
Thank you. Okay. I would like for everybody to give a round of applause to all of our speakers and their responses. We really appreciate that. Now we are going to give a brief overview of the KYB rejuvenation stations. So first, we have Ariana, who will be leading a meditation station and giving brief history of meditation, how meditation has helped her, and a demonstration of meditation. And then next we have me, and I will be hosting an I Am Amazing small little vision board poster session where we're all going to drop in the chat how we are amazing and how we can be amazing. Next, we have Lillian, who will be doing her journal station, and she will have you all journal about your experience so far. And then we have our rejuvenation station featuring Eric Sanders from Victory Yoga in Detroit, Michigan, and he will be taking you through yoga. And then we have our KYB Lemon Body Sugar Scrubs rejuvenation station with KYB leader Hallie Sheffield, and you're going to learn how to make sugar scrubs. Thank you.
Hi, I will be taking you through a brief history of meditation along with a demonstration at the end. Meditation has been around for a very long time. It was first recorded in around 1500 BCE in India, specifically in Hindu schools. It has since then spread to other Eastern cultures, such as Chinese Taoism and Buddhism, and later was adopted and adapted by Western culture. My personal experience with meditation has been very enlightening. I use meditation to take time to myself and become aware of my body, thoughts, and feelings. Today, it was important for me to give you an opportunity to practice something that may help you. I will now take us through a short breathing exercise. The first step will be a series of breathing. When I say breathe, I want you to inhale through your mouth and blow out through your, inhale through your nose and blow out through your mouth. I'm sorry. I will demonstrate. Now, I want you to try, but we are going to hold our breath. Breathe in for 4 seconds, 2, 3, 4. Hold for 7, 2, 3, 4, 5, 6, 7. And breathe out for 8, 2, 3, 4, 5, 6, 7, 8. Try to be aware of your body while breathing. Think about the way your lungs feel and how your feet press against the ground from your chair. Now let's breathe again while thinking about these things. Breathe in for 4, 2, 3, 4. Hold for 7, 2, 3, 4, 5, 6, 7. Breathe out for 8, 2, 3, 4, 5, 6, 7, 8. Thank you for taking the time to practice. If you are breathing, it means you're alive. Take time to practice this on your own and reset your day. It is very refreshing.
Hello, greetings again. I'm KYB leader Olivia Dove, and I wanted to take you through our KYB I Am Amazing vision posters. You only need a few supplies, which will be pencils and paper. So if you are able to go grab those things, I'll give you a couple minutes to do that. And once everybody is ready, could you hold a thumbs up or put one on your screen for me to see? Alrighty, the word amazing is powerful for KYB. We each identify 21 things that make us amazing. For example, I love to sing and dance. I am amazing. I am a great student. I am amazing. For the next few minutes, I want you to write 6 things about yourself that make you amazing. Please put at least one in the chat and remember to end with I am amazing. I'm going to read a few of them. Okay, so from Lillian Floyd Thomas, KYB leader, we have that she likes to read and that she is amazing. I like to read too. These are very good examples. Yes, you are very loved, Mom. You are amazing. Lillian has played piano since she was 3. She is amazing. That is very impressive. I wish I had kept playing the piano. Miss Eleanor said that life is good and that she is amazing. Amara King said that she is not like anybody else and that she is amazing. Miss Trinae said that she is amazing because she likes to use spiritual gifts. And Ariana Lee said she is dynamic, she is amazing. These are all very good qualities to have. Oh, Bailey said that she can paint and that she's amazing. I appreciate that you guys have dropped your little examples in the chat. And I want you guys, as you continue through life and wherever you go, to remember that you are amazing. Thank you.
Okay. Hello, I'm KYB leader Lillian Play Thomas, and I will guide you through the Journey Journal station. A big part of mental health is being able to communicate and express your feelings. Sometimes the best to express your feelings is through journaling. This station, for this station, I would like to ask everyone to get a piece of paper and a writing utensil. And I'll wait about like a minute for everybody to get that if you don't already have it. And then after everybody gets their piece of paper, I will ask you to answer this journaling prompt from the KYB Mental Health Journal. And give me a thumbs up if you already have everything. Okay. So the journaling prompt from the KYB Mental Health Journal is: create a morning mantra for yourself to start the day right and to remind yourself to stay positive. The mantra helps you to set goals for yourself, reminds you of who you want to be and what you want to achieve. For example, the KYB mantra is: today my words will express to everyone and to myself that I am a leader. Today my thoughts will be a constant reminder that I am a leader. Today my actions show the world that I am a leader. I am a KYB leader. This mantra reminds us as KYB leaders that our words, thoughts, and actions have power, and it guides all that we say and do. Now, I would like everyone to answer the journal prompts that I previously said. Create a morning mantra for yourself to start the day right and to remind yourself to stay positive. And then give me a thumbs up when you have written your mantra. Or if you're done writing a mantra, can you please say that you have been like on screen.
My mantra was, I am ready and prepared for the day. I will succeed at everything I do, and I will end the day with a great attitude.
My mantra was, today is going to be a great day. It is a beautiful day that the Lord has made. Let me rejoice and be glad in it.
Mine was, today is a new day. Today will be a new sleigh.
Thank you all so much for sharing those amazing mantras today. And now we will transition. Our KYB leader is having some technology challenges, and I think she may be back on. Are you back on? All right. We're going to go to our next session.
Yes, ma'am.
Are you there?
Yes, ma'am.
All right. Welcome back.
Thank you. Once again, thank you all for reading your mantras. I'm sorry it kicked me off again, but I want to leave with this one quote by Miss Marianne Williamson, and it is in one of my favorite movies, A Cure on the Beat. The quote is, "Our deepest fear is not that we are inadequate. Our deep fear is that we are powerful beyond measure." We ask ourselves, who am I to be brilliant, gorgeous, talented, fabulous? Actually, who are you not to be? We're born to make manifest the glory of God that is within us. As we let our own light shine, we
And as we let our light shine, we unconsciously give other people permission to do the same.
And our next speaker will be Mr. Eric Sanders. Thank you all.
Okay, hello everyone. I am happy to be here to present regarding yoga and mental wellness. And the coverage today has been wonderful when it comes to, as we've heard several times about being still, breathing, how I had questions regarding how do I, as far as therapy goes, how do I can go see someone, but in my own space, how do I deal with these things if I want to work through some things myself? I've been working closely with Miss Lauren Smith, and I am going to, on her behalf, present regarding yoga. I am a certified yoga instructor. I also work at a university, and I work in student services. I work with college students, freshmen students to senior students, making sure that they're successful in their studies. And a big piece of that is their mental health, because we understand that education and higher education can be very stressful. All right. And we want you guys to succeed, but coping and skills and aren't taught. It's all content is what you're learning. Their job is to teach you content. But from my perspective, I became a yoga instructor because I wanted to touch on the psychological, mental well-being when working with my students. Okay, so I'm going to share my screen real brief. I do have a PowerPoint. And there we go. Share my screen here. Okay, 1 second. Okay, slideshow. Okay, so what is yoga? And I wish I was exposed to yoga at a younger age, such as yourselves. It wasn't until my I'm not going to say my age, later on in life, that I was turned on to yoga, and it was really out of wanting to serve others. It was really out of wanting to work with my students. And as I was looking up different websites, looking at different psych methods and activities to work with my students, I said, you know what? I was seeing that a deeper dive was actually in yoga. I had never touched on it before. And when I got involved, it has changed my life. And it's all about me sharing it with others. So I'm glad to be here to do that. But yoga means to yoke. It means to unite. It means to unite you with a community of other people with like-minded ideas. And I know everybody else was short, and I'm so passionate about this. I'm just getting started, but I am going to cut it short because I could go on and on and on. Okay. So when you are, a lot of people will go to a yoga session, and there'll be a newbie and they don't know what it's all about, and they're starting to look at the instructor, and he's walking you through these poses. His job is to cue the poses and you are to follow. And a lot of people get lost because they feel awkward because other people know what they're doing and I'm a newbie. So they don't return. But the thing is, what I want to share with you is that there's yoga, there's 8 limbs of yoga, right? And that's the framework, is the limbs. And the limbs basically gives you different aspects of yoga. So it's not all about the mat and doing the postures. There's the mental wellness piece. And this is what I'm going to talk to you today, because of course we cannot walk through the postures, but I can explain to you how yoga and connecting your breath with movement is therapeutic. Okay, so those are the things I want you to understand. Breath and movement is therapeutic. And I want you to look at breath and oxygen as energy. It's because when you believe in something, you're more likely to change your mental mind state when you have this belief. So when you believe that oxygen is therapeutic and is healing my body and my mind, every breath takes on a new meaning. Okay, so I need you to look at every breath is worth $1 million. So when you are walking through these poses and you're connecting your breath with your movement, you are taking on healing and $1 million worth of healing into your body. So going to my next slide, we talk about meditation and we're focusing on your breath. So meditation through a yoga standpoint is that our minds fluctuate up and down. We're always thinking about what's next in the future and what happened in the past, and then what is happening currently, right? So when you're in meditation, you want to live in the now. You want your mind to be in the now. You want to clear your mind from fluctuations of what I need to do in the future and things that you didn't do or you did wrong in the past or you did right in the past. We want to meet me on the mat right now, and you want to practice breathing, and you want to clear your mind, and you want to live in the now. Yoga and meditation helps you focus. So this is when I'm talking to my students, and some students study in different ways. They will have music playing. Some people need complete silence. And I say, okay, how do you focus? What helps you focus? And then once they figure out, okay, this is what helps me focus, then I say, okay, so let's meditate here briefly. And the purpose of your meditation is for when you to come out of that meditation, you have a certain level of clarity. And you're looking at what's coming up in a whole different light after you've cleared your mind and you've had deep breathing techniques. So let me go to my next slide. So the ocean breath is what we call pranayama. And it's what it is where in the back of your throat, you're going to be able to hear and feel, just like if you were blowing into a mirror. You know how you blow into a mirror and you see the fog? And that sound that you're hearing is what you want to hear when you're inhaling through your nose and exhaling through your nose. So when you're hearing that sound and you're doing the posture, that's the connection. And you're in a room with 20 other people, but you'll feel like you're in the room by yourself. And then once you are connected with the other 20 people in the room, that is the yoking piece, because now you're all one body, one movement, one sound, and you are breathing and inhaling at the same length and level of the movement, and you're exhaling all together in unison with the same movement and breath. And you'll feel like you're in there by yourself because you're so focused, but at the same time, you have a sense of unity and community with the rest of the individuals in the room. So you leave out with a whole new bond with these people. When you came in, you didn't know them. But when you leave, you have a bond with them, because some people are releasing stress that's built up in the body. Some people will start crying because it's therapeutic, like I said. So when you are holding a pose for longer than what you would normally physically endure in life, and then you feel like you've reached a triumph, because when you came in, you couldn't touch your toes. When you started yoga, you couldn't touch your toes. But after, say, a week or 2 weeks, you're like, wow, I can touch my toes now. Wow, I can do this pose. Wow, I have better balance. Wow, I have more mental clarity. And now you are addicted. You are practicing yoga, because a lot of us may practice the violin. We may go to practice volleyball. We may, you practice a religion. But there's a such thing as you practicing yoga. That means you are doing it on a daily basis, and you're living the lifestyle of a yogi. So when I say that there's 8 limbs, there's aspects of it that pertains to diet. It's aspects of it on how you treat others with respect. There's aspect of it on your time management. There's aspect on it on how you view the world. So it is life-changing when you have a deeper dive and you start to read about what your id means, what your ego means, and how your ego plays a part in your life. It is transformational and it is therapeutic. I just want to do one more thing in my slides before I close out. I want to go to here. My way. My panel is in my way. Okay, I want to go here. I just want to briefly give you an example of what yoga looks like. If you've never seen it or experienced it, it's kind of hard to do here, but I'm going to take a shot. So Sun Salutation A, B, and C, these are a flow of poses that's put together so that you are moving from one pose to the next in a seamless flow. And a lot of studio yogis will have actual music playing along with these poses. So across the world, Sun A, Sun B, and Sun C is universal. It does not change. So you can go to California and do yoga, and they're going to include a Sun A. It warms up the body to get you ready to do some of the more strenuous poses. So you can go to California, you can go to Asia, you can go anywhere, and Sun A is going to be the same. Sun B is going to be the same. So this is what Sun A looks like. You're going to go to mountain pose, you go to upward salute, standing half forward bend, high lunge, bottom of a push-up, upward dog, downward dog, mountain pose, hands reach up, hands to heart, and namaste. So this is what it looks like. So this is how you start off doing Sun A. So it's all about inhaling and exhaling and holding those breaths for the complete movement. So then you inhale, raise your hands up. You exhale, half forward fold. Inhale, halfway up. Exhale, down to a push-up. Inhale, cobra pose, upward facing dog. Exhale, downward dog. Inhale, forward fold. Exhale, halfway up. Inhale, tree pose, and then you're going to exhale into the prayer position. Normally that's here, and then you say namaste. Okay, so that may look simple, but when you go to a yoga studio, you're going to do that about 5 times consecutively. And this is to get your body warmed up and get you ready for the actual poses. It's almost a workout. You will sweat a lot. You will get a good stretch, and it's called, you have at the end of it.
Excuse me.
I'm sorry, I'm going too long. Cut me off.
Sorry.
Please.
Oh, my bad. I'm so sorry. I don't think we could see the illustrations of the poses.
Can you see my screen?
Yes, sir, but I think it's frozen.
Oh.
Yes, we see the ocean breath description.
I'm sorry, I don't know why it's not moving because I can see it. Let me see. Let me stop sharing, then stop again. Start again. Okay. I'm sorry. Can you see it now?
Yes.
Yeah. Okay. I know that was awkward. Okay. Well, briefly, I'll go through that just briefly again. Sorry about that. Thank you for speaking up. Okay. So this is Sun A, and these are the different poses in Sun A. And then, so this is when you're going to inhale, you're going to exhale up, exhale, I'm sorry, inhale, exhale, exhale down, inhale, exhale, inhale, exhale, inhale, exhale, inhale. Then you're going to, when you have your hands up here, you're going to exhale and bring them to heart center. And then you say namaste, which means I respect you. Okay. So this is, as I was saying, Sun A. And then Sun B has a couple of different moves in it. And then Sun C, the same thing. They're very similar and they're universal across the board. So I want you guys to inquire more about yoga. If you Google it, it'll bring up so much information. But when you talk about therapy, when you're talking about connecting your body with movement and what breath can do for your health, what deep breathing can do for health, you'll be amazed. You'll be amazed. You will want to share this with others once you have the experience yourself, and it brings a sense of calmness to your body. And when you have stressful moments, you'll start to say to yourself, well, I need to get on the mat. I need to go home and get on the mat. You won't say, oh, some people have other vices that they go to when it comes to stress, but this is a stress reliever. And you'll say, I just need to, let me go outside and do some stretching. Let me go outside and do a couple poses. Let me breathe in some of this fresh air because it relaxes me. I'm going to stop here. And what I want to leave you with is namaste. I respect you, and I want you to go forth and dive deeper into yoga. Thank you so much.
Thank you, Mr. Sanders, for opening up this evening.
No problem.
Does anyone have any extra questions for Mr. Sanders?
What's your favorite pose?
Okay, that's a good question. I would say my favorite pose is upward dog. Because how it opens the heart. And a lot of poses, you'll hear that in a lot of poses is open your heart. And that's the pose where, it's also called cobra pose. That's the pose when you are down in a push-up position and then you raise your chest up and you open your heart and you take in. It's one of the movements where you're inhaling and you can just feel the pressure on in your chest. And so I would say that upward dog is my favorite pose. Any more questions?
How did you get started in your career?
Well, my full-time career is working with students at a university. But my yoga career started, I received my certification last January. And I just this semester, I will be teaching courses in our fitness center 2 days a week through the university. So they have hired me on to teach yoga in our fitness center with our students. So this was my first dive when it comes to a weekly regimen and schedule teaching a class. I look forward to it. My first class will be Tuesday. I taught some classes last semester, but those were basically me volunteering because I wanted to share my knowledge. But now I'll be working the whole year. And I look forward to expanding and working at other studios and hopefully possibly opening my own yoga studio, because in our community, the African-American community and people of color, health and wellness, I'll just say that, some people, when they think about yoga, they don't think about our community doing it. When you see visual images, a lot of times you don't see people of color doing it. So I just want to say that, my career in education started, over 20 years ago. And now my career in education, when it comes to health and wellness, started about a year ago. And it started because I wanted to help others find mental clarity and wellness. Any other questions? Okay. Thank you, guys.
Thank you.
Hello, I'm KYB leader Hallie. Today I'm excited to show you how to create a lemon body scrub using simple ingredients like lemon and lemongrass essential oil, fractionated coconut oil, and sugar. But this isn't just about skincare, it's about self-care for both physical and mental well-being. Before I tell you about how to make this scrub, let's remember the benefits it brings beyond the physical. 1, exfoliation. Just as we shed dense skin cells, we can let go of negative thoughts and stress, leaving minds feeling rejuvenated. 2, brightening. Just as lemon brightens your skin, it can also brighten your outlook, reducing the appearance of blemishes reflects our ability to overcome challenges. 3, antioxidant properties. Much like antioxidants protect our skin, mindfulness and self practices protects our mental well-being from the effects of daily stress. 4, aromatherapy. The scent of lemon and lemongrass essential oil reminds us that small acts of self-care can uplift our mood and reduce anxiety and provide moments of tranquility. Now, I'll demonstrate how to make the scrub in easy steps. First, you're going to take sugar and pour it into a bowl. Second, you're going to take fractionated coconut oil and add it to the. Then you're going to take your lemon essential oil, and then you're going to add your lemongrass essential oil. After that, you're going to take a spoon and mix it very well. It should look like this, if you can see it. I'm sorry if you can't, but it should look like this. And then when you're done, you can take a container with a seal on it and put all of your sugar in the seal, and you can label it with a personal touch if you would like. Let's keep in mind to incorporate self-care to your routine for both physical and mental well-being. Let's embark on this journey of self-care and mental well-being together. Thank you for joining me in my self-care and mental health awareness journey. Is there any questions for anyone?
Is there any other scrubs that we could make besides just lemon one? Would like lavender be good as well?
Yeah, you can use any type of scent, like of oil that you want, just one that is preferable to you or one that smells good to you. But yes, you can use any type of scent that you would like.
All right. Thank you all for sharing. Remember, each day is a great opportunity to be your amazing self. Thank you all for sharing. Um, this concludes our virtual KYB rejuvenation stations. I will now turn the program over to KYB leader Ariana for closing remarks.
Thank you. Thank you all again for attending today's event. I hope that you all learned something about mental health that you either didn't know or may have not known, and you may even remember something that is inspiring and that you can share with family and friends. Please complete the survey placed in the chat and before you leave to just answer some brief questions so that we can get feedback about today's event. Do this before you log off. Thank you again for joining. This was an informative program. As co-chair of this event, I ask you to join me in giving another virtual round of applause to our chair, Amara, to all of our amazing speakers, to you, our guests, the team at RBW PH Awareness Group, and KYB Leadership Academy wants you to know that we truly appreciate you and that we hope you have an amazing day. Once again, please complete the survey before leaving.